Good afternoon and welcome to the daily briefing at St. Clair County EMA office. Joined here today with Randy Randolph, who will be giving our zip code updates today in lieu of Chairman Kern down in East St. Louis with the governor and his task force members on the test site at the Jackie Jarner Kersey Center. And of course, we're here with Sam Bierman, the one and only, the number lady as we call her, and not too good today on some deaths.
Not too good. We've seen a rise in all categories across the board today. So as of today, 6,425 tests have been performed in St. Clair County, with 1,134 positive test results, which is an increase of 17 from yesterday, and that does include both men and women from their 20s up to their 100s. We are at 5,199 negative test results, with 92 test results still pending. And as Herb had said, we do have some sad news to announce. We are reporting 6 new deaths today, which brings our total as a county to 89. The first, a male in his 60s. The second, a male in his 70s. The third, a male in his 80s. And 3 females in their 90s, all who did have underlying health conditions. And as always, our condolences go out to those families who have lost loved ones to COVID. For those that have completed the IDPH 14-day required quarantine, we are at 722. And for state totals, 803,973 have been tested, with 114,306 positive test results, which is an increase of 1,111 from yesterday. And for the state, we are at 5,083 deaths, which is an increase of 160 from yesterday. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, we have 55 patients that are admitted due to COVID-related reasons, and 3 of those patients are on ventilators. For our congregate living facilities that are in outbreak status, and that includes 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. Brea of Belleville has 24 cases and 3 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 11 cases and no deaths. Cedarhurst of Shiloh has 11 cases and no deaths. Cedar Ridge of Lebanon has 4 cases and no deaths. Colonnade Senior Living in O'Fallon has 4 cases and no deaths. Four Fountains in Belleville has 104 cases and 23 deaths. Help at Home in Belleville has 2 cases and no deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 8 cases and 1 death. Lebanon Care Center in Lebanon has 52 cases and 10 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. New Athens Home for the Aged has 36 cases and 1 death. St. Paul's Home in Belleville has 37 cases and 10 deaths. Swansea Rehab and Care Center has 8 cases and no deaths. And finally, TDL Incorporated in Belleville has 4 cases and no deaths. And now I will send it down to Randy for zip code updates.
Thank you, Sam. We appreciate everything that you do each and every day. For today, we're going to do the zip code reports, and as we always like to remind you, these numbers, just if your zip code is not listed, it doesn't mean that you do not have any active cases in your zip code. It simply means that it has not met the threshold of 5 or more for that area. So starting off, we're at 62059 with a total of 7 cases. 62201 with 15 cases. 62203 is at 36 cases, which is a decrease of 1 from yesterday, which, as we always like to remind our viewers, that situations may change where a resident may no longer be in that zip code. Maybe after they're released from the hospital, they are sent to a different facility or to a different residence, and so those zip codes may change. 62204, there are 43. 62205, there are 44. 62206, there are 94, which is an increase of 1 from yesterday. 62207 has 67 cases. 62208 also has 67 cases, which is an increase of 2 from yesterday. 62220 has 130 cases, which is an increase of 3 from yesterday. 62221 now has 99 cases, which is an increase of 1. 62223 has 48 cases, which is an increase of 1. 62226 has 128 cases, which is an increase of 1. 62232 has 19 cases, which is also an increase of 1 from yesterday. 62239 has 13 cases. That remains the same. 62243 has 8, which is also the same. 62254 is 27, the same as yesterday. 62257 has 8, which also remains the same. And 62258 has 16, also remaining the same. 62260 has 6, the same as yesterday. 62264 has 36, which is an increase of 6 since yesterday. 62269 has 69 cases, which is an increase of 1. And 62285 is at 10, which is the same as yesterday. And that is all for the zip code reports. And now I will turn it over to Mr. Simmons, Director Simmons.
Thank you, Randy, for filling in for the chairman today as he's taking care of just as important business in East St. Louis at the testing site. We heard the numbers, the zip codes, and we try to bring you that information every day. As I said, the numbers of deaths, one is too many, as we've said since the beginning of this. For 6 of them overnight is something that I just ask you all to remember and keep those families in your thoughts and prayers. And as we've seen through this whole epidemic of the COVID-19, there's been a lot of challenges. And the challenges that not only with our people in the nursing homes, but just in our everyday lives. But one group of individuals that we need to talk about today and is some expecting mothers. And we're fortunate today to be joined here by Deb Medell, who is the nurse manager of the Woman and Infant Center at the HSHS St. Elizabeth's Hospital. Welcome, Deb.
Thank you.
We appreciate you coming in and kind of going to give us a little update on what expecting mothers are experiencing through this COVID-19.
Okay. Well, they are unprecedented times for sure. So there is a lot of, anxiety and fear about the unknown and what to expect. So we try as much as possible to alleviate those fears, and we talk to anybody who calls up. We will gladly talk to them, tell them about what to expect to their visit. Their visitor policies are out in the public as far as the doctor's offices and things like that are also getting this information out to their expected mothers. We just know that the biggest thing for them is to make sure that they are safe and that they feel safe and supported during this time. So that is our biggest thing that we're trying to do to support these moms that are and doing that. So we have a lot of safety precautions in place, and we're really trying to ramp that up and make sure that they feel comfortable.
Good. Are pregnant women at greater risk for getting the COVID?
So the risk is about the same as it is with a non-pregnant person, but because of the pregnancy, they are at an increased risk for severe illness when infected with any other, kind of viruses. So the best practice is to try and limit that
Right.
risk of infection. So.
And so some of the precautions that an expecting mother could take would be the social distancing. Is there? You said there was a list of them that
Correct.
They follow.
Same as any other social distancing, washing your hands frequently with soap and water or alcohol-based sanitizer, making sure that you're wearing a mask in public. Washing down your surfaces at home and frequently placed areas that you're touching. So it's the same as it would be for anyone.
Good. And these COVID times have been unusual situations for everybody. What are you hearing from these expecting mothers and I guess they're the fathers allowed to come in?
Yes.
So what are you hearing from them?
So, the concern is, to come to a hospital with COVID patients, what to expect. So, we reassure them, we are taking all the measures and their safety is their top priority. So, we're taking all the measures that we can to reduce that risk for them. We do have, unfortunately, the visitor policy is the one support person, whether that's, whoever they name that to be. But that person is there with them for the duration of their stay, and just not allowed to change out or anything like that. But it's for the protection of moms and babies, and not only themselves, but our other moms and babies that are up there as well.
Good. And what are some of those added safety measures that they've had to put in place?
So we have a lot of things that we do before the patients even hit the building. We have our, ER tent outside. That's the triage tent. We also screen patients, and we also pre-screen them prior to them coming in. We also have different units that these, if we have COVID patients that are on. So, and these units are not near our Women and Infant Center. So.
Okay. And one of the questions we get quite frequently is, what about the tradition of everybody wanting to come and see the newborn at the hospital? I know you talked briefly about all the procedures, but have you had those days where you've had to just say, no, we've had these policies in place? Because, it's always been a tradition.
Yes, we do, and it's very hard. Social media has really helped in that respect. FaceTime is huge. Being able to, show the grandparents by FaceTime their new grandchild, and just a lot of it's really hard. You want to support them, and you want to be there, and you want them. It's still happy time, and you want to be able to have them share it with everybody. So unfortunately, the social media is the best way right now to do that. The nurses have also taken on an extra role in that too, as well as helping kind of be that person, that extra person there for them when they're expecting other people that they want there, just to kind of fill that void. But there is a positive, on that too. When I do leader rounds, I do rounding daily on my patients, and during that time, I've gotten actually quite a bit lately. Just with, it's been really a blessing in disguise, because it's, just promoted so much more bonding that we wouldn't have had, had all these visitors be coming in and out, and handling the baby. The baby, rests better, sleeps better. And the mom is getting more rest as well, with the, not as many interruptions with the visitors and things. So they said it's actually been a blessing in disguise. And with that, they can, I think, people are going home a little faster too. So, they're getting to be able to go home faster. So.
Have you seen noticed a busy time through this COVID? I mean, are you seeing more babies being born, or?
I would say it's about the same. Babies are, have their own timing. So in a pandemic, that doesn't affect it. So no. Babies will come when they come. We have seen a decrease in our outpatients. They don't come up as much for the little things that they kind of would have come in for before. They're kind of holding off on maybe if it's a cough or something like that, and just staying home versus coming to the hospital to get checked out.
And that's one of the things that we've had some of the other medical experts on talk about, that there's no need to stay home. If you were feeling bad, there was this fear out there for a while that the hospital, we don't want to go because of the COVID. There's no reason for them to feel that way, is there?
No, not at all. And that's, we do a lot of that telephone as well. Hey, if you need to come in, you need to come in. Please don't stay home until you can't stand it anymore. You need to come in if you have contractions, if they're if the baby's coming, you need to come. You can't stay home. So
we want them at the hospital where it's safe. And
yes, and we've done all we can to make that safe for them, and so there's no reason why they shouldn't be able to come.
Well, and we talked before we came on today, the hospitals have really been out in front of this, and from day one, they've really taken all the precautions, and we appreciate all of that. How is your staff holding up? It's been a change for them, I know. I mean, everybody seemed to still be bonded together?
Yes, I think more so during this time, just relying on everybody. I just want to take a little bit of time just to shout out to my my unit and my colleagues, because they have done a phenomenal job of just being adaptable. I think that's has been a huge key during this time. It's just constantly changing. Just when you think you have something in place, something else pops up and a new guideline comes out, and so you have to be adaptable and change and just roll with the punches. And they've done a phenomenal job with that. They have done a phenomenal job with, they go above and beyond all the time, but just digging in a little bit deeper just to give that extra because of these times, and because these patients are, a little more apprehensive and don't have the normal support that they would have had they not had this pandemic going on. Then just digging in and giving that extra support and whatever that they need, just to feel that they're supported and they're safe. And it's just been really encouraging to me as a manager, just to see them all come together in these times. And
well, I think it's worth saying that they become more than just that nurse at the bedside. They become part of that family because of the restrictions that are on. So that's part of that support group you're talking about.
Absolutely.
And we really appreciate everything that you do and your staff. It sounds like you've got a phenomenal staff.
I do.
And for all of you expecting mothers out there, that's kind of a little insight on what Deb has gave us here today. Don't stay home if you're having those what you think are pains or whatever. Come to the hospital. That's where we want you to be there to deliver that beautiful baby boy or girl. And Deb's staff will take care of you. She heard her say that. So again, we appreciate you coming in today, taking the time, and please keep up the good work.
Thank you.
Thank you very much. And that's what it is. If you're one of those expecting mothers out there, if you know one of them, tell them it's safe to go to the hospital. We're trying to get back to the norm here. On the PPE side, we had 41 agencies pick up supplies today. Randy, we heard cars and trucks coming all day long. So
From the moment that it started.
From the moment it started, the logistic people, we want to give a shout out to Rick down there. I know he tunes in sometimes. We couldn't be doing this with him and Crystal and them has been going down there helping out. So
Absolutely.
It's really a plus. It's a teamwork. It's Team St. Clair, as we say. We appreciate those of you who are putting that Team St. Clair out there, because we're all in this together. St. Clair County, we said from day one, we're going to continue these briefings until we get back to whatever that new norm is going to be. And we're just fortunate to have the team that we have here, the St. Clair County Health Department, the Eastside Health Department, all of our first responders, to all of the mayors out there, our calls that we do with you. We couldn't do it without each and every one of you. So we're glad to have you aboard on Team St. Clair. We'll be back tomorrow. Chairman Kern will be back with us. We'll be back here in just a few moments with Cindy and Daisy to translate this into our Spanish communities. Have a good rest of the afternoon. Thank you.